My name is David Louis and I was appointed onto the Consumer Advisory Committee in April 2014. I came onto the committee with the intent to represent Pacific people and bring the Pacific voice to the table, as well as bringing the many years of experience and interactions with various communities, those on the margins, those of the poor, and those whose voices are not often represented.
My name's Stephanie Clare. I'm the Chief Executive of Age Concern New Zealand, and on the Consumer Advisory Committee I support the views and voice of older people in our community. I support also an opportunity to share what's going on in medicines for the older people in New Zealand.
My name's Adrienne and I put my hand up for the Consumer Advisory Committee because I've seen from my own experience how much knowledge, how much wisdom, insight and experience sits out there in the community that can be brought to decision making to an organisation like PHARMAC. As a result of that, PHARMAC makes better informed decisions, we get better health outcomes, and at a personal level it's really inspiring to sit alongside my fellow committee members and benefit from the learning that I get from them that we can bring to PHARMAC.
Talafo lava malolei. My name is Tuiloma Lina Samu. I am part of the Consumer Advisory Committee, and I wanted to be on this committee because I really believe that Pasifika people here in Aotearoa, New Zealand, we've got a lot to contribute, especially being on these committees, to add our voice and to add our perspective. And I'm also a PhD public health researcher as well. So I thought that I could add my skills and my knowledge, and being a very proud citizen of this country, to be able to contribute my viewpoints, especially around pharmaceuticals, medical devices, and all of the cool business that PHARMAC takes care of.
I am Lisa Lawrence and I wanted to join the Consumer Advisory Committee because I believe in helping people to help themselves, and the health system needs as much help as it can get, and I think Māori can be a part of the solution with what they bring around holistic healthcare.
Kia ora, my name is Te Rōpū and I hail from Ngāpuhi, Northland, far north and mid-north, a place called Kaikohe, and I wanted to be on the committee to contribute to making a difference on behalf of my community and service them in terms of the education around PHARMAC and the role it plays in terms of medicines.
I'm Neil Woodhams. I'm the Vice President for Multiple Sclerosis New Zealand, and my interest in being on the Consumer Advisory Committee is to try and represent the community of disabled and people with chronic illness, which is a different community to those that have an acute illness. And I've enjoyed my time. I think it's a wonderful initiative from PHARMAC, and one in which people should have confidence that there's a wide range of views from the consumer being expressed to PHARMAC, and PHARMAC listen to it.
I'm Francesca Holloway and I'm Awareness and Advocacy Manager at Arthritis New Zealand. I bring a particular interest in looking at good health outcomes for people who have long-term conditions and people who live with disability. One of the strengths of the Consumer Advisory Committee is the diverse backgrounds and experience that we bring to the table, and the work that we do, we believe, ensures that the voice of the consumer is heard at all levels within PHARMAC.